Goeienaand, good evening, fellow South Africans and citizens of the world. And earlier tonight we had an absolutely amazing live stream with Dr. Peter Hammond. Went for over 3 hours. I had to call it off. We were just carrying on and carrying on. But it was really, really good. We had up to over 400 people watching us at any time. Now, what are we talking about here in this video? Well, it's what's actually going on with the coronavirus in South Africa. You know that they're claiming that they've just got about 1,600 cases and they're only getting about 30 new cases a day and stuff like that. That's all BS. That's why the ANC government are trying to suppress any discussion in the media in South Africa over what is actually going on with the coronavirus. I'll give you one classic example. Just one hospital in South Africa. Netcare is investigating a COVID-19 outbreak at St. Augustine's Hospital in KwaZulu Natal, where 4 people have already died from COVID-19 and 47 staff members tested positive, and measures have been put in place to contain the outbreak. In a statement on Wednesday, Netcare CEO Richard Friedland said 33 of the 47 staffers were self-isolating and the remaining 14 were accommodated at Netcare's facility to ensure that they were able to be safely quarantined. Now, consider the case of those 2 doctors who are now in enforced quarantine in the Limpopo region when they were already self-isolating because they were white, young, and female doctors. Absolutely disgraceful. Anyway, that's a different story. If you go and have a look at the older videos, you'll find out a lot more about this. In a statement on Wednesday, Netcare CEO Richard Friedland said 33 of the 47 staffers were self-isolating and the remaining 14 were being accommodated at Netcare facility to ensure that they are able to safely self-quarantine. The hospital group has roped in Professor Salim Karim, who is a special advisor to the Minister of Health, and a team of epidemiology and infectious disease specialists from the University of KwaZulu Natal to fully investigate the underlying cause and nature of this outbreak. Well, it's simple. It's called a cluster. It's where they all sat around drinking out of cups in the tea room, and someone who's infected left the virus on there, and someone else drank from that cup and it hadn't been washed properly, and they picked it up, or they say them on the table in the kitchen room, or from a document, maybe a file, a patient's file. That's how it is spread, and this is a classic example of a cluster. 15 patients also tested positive and have been accommodated at the hospital. One of them has since recovered and tested negative, he said. The hospital is now in a process of contacting all patients who have been treated in its emergency department since the 1st of March to determine if they require testing. St. Augustine's shut its emergency unit on the 2nd of April after staff members were found to have contracted coronavirus. Now, remember, this is a private hospital, not a public hospital. Can you imagine what's going on in the public hospitals? Can you understand why the ANC government are censoring any discussion on the coronavirus in South Africa? It was previously reported that 3 people have died from the coronavirus at the hospital, but the hospital confirmed on Wednesday that number had increased to 4. The hospital is undergoing a deep clean in the wake of this. On Tuesday, Mkhize expressed concerns about the number of healthcare professionals who contracted the virus. He said more than 60 people tested positive, including patients. He said, "We are concerned about developments at St. Augustine's Hospital. The provincial department is engaging the hospital about closing down parts of the facility. We must now trace all the contacts. It is a matter of serious concern and we are dealing with it." Friedland said the hospital was putting measures in place to contain the outbreak, which included a decontamination process, mass screening of staff members, and a multidisciplinary investigation into the cause of the outbreak. There are 1,982 people who work at the hospital, and more than half have been tested for COVID-19, Friedland said. Friedland said COVID-19 symptomatic screening of all persons working in the hospital is continuing on a daily basis, as some individuals could be asymptomatic but start showing symptoms in following days. So there you go, guys. This thing is going rampant in South Africa. It's hiding behind the doors, if you know what I'm talking about. This ANC government with their testing kits are so far behind the ball, it's incredible. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe. Bye for now.